my name is Andrew Green, PN student, and today I'm going to demonstrate reconstituting medications, withdrawing medications from a vial, and then injecting medications into a patient. So I'm going to begin with my hand hygiene as I compare my doctor's orders to my MAR. So I see that I have Shirley Cost, a 54-year-old female, and her date of birth is 5/14/64, and that does match on my MAR. Shirley Cost, 54, female, 5/14/64. And now I can see if my medications match. So I have PPD test on right arm, purified protein derivative, diluted 0.1 milliliters ID ounce, so that matches. Ceftriaxone, 250 milligrams, IM. Ceftriaxone, 250 milligrams, IM. And okay, so that matches good. And now I have my promethazine hydrochloride. So I have promethazine hydrochloride 25 milligrams, IM PRN. Promethazine hydrochloride 25 milligrams, IM PRN. And I was previously in with my patient and they did complain of nausea, so I can give that because I see it was last given at 11 p.m. last night, and it is now, these are now my 10:30 meds. So I will get some gloves, and while I do that, I'm just going to verify my patient bin with my MAR. So Shirley Cost, 54 female, Shirley Cost, 54 female, 5/14/64, room 211-1. Perfect, so that matches. So now that I have my gloves on, and I've checked my healthcare provider orders with my MAR, I can start doing my first check with my medication. So first we have our PPD. So we have purified protein derivative, diluted 0.1 milliliters. Purified protein derivative, and that matches 0.1 milliliters. And I know that that needs a sterile water with it. And then we're going to have our ceftriaxone. And our ceftriaxone, 250 milligrams. And I know I will also need sterile water with that. And lastly, we have our promethazine hydrochloride, 25 milligrams. So promethazine hydrochloride, 25 milligrams per ml. So that's perfect, okay. Okay, and I know that my PPD test is for a TB test. Just underneath the skin, my ceftriaxone is for anti-infection, and my promethazine hydrochloride is a nausea medication, which the patient had confirmed that they were nauseated this morning. So I'm just going to take this out, and now I can start with my second check and putting my medications into the needles. So I'm just going to take out some alcohol wipes. So I know I'm going to need some gauze, and I'm going to need a Band-Aid. Okay. And I will need a few alcohol wipes on my tray as well. Okay, so let's start with our PPD, purified protein. So I can take the cap off that, off this water as well, and I will need 2 alcohol swabs. And I can wash both them for 15 seconds. Okay, and then I will do the other one. Okay, and as that dries, I will just throw my garbage away. Okay, and I will grab my needle. So I'll be using a 3 milliliter syringe with like a 23 gauge needle to withdraw the water. I can take the cap off. So I'm going to need 3 milliliters of air. So I have my 3 milliliters of air, and I will inject it into my sterile water. And then if you just want to see that I can get 3 milliliters, I'm just going to make sure this is below the water line, and then inject. 3 milliliters of water. And I can see that I do have some air in there, so I will put a little bit extra so I can squeeze that air out. Okay, so I have a little bit extra in there again, just so I could squeeze that out. Okay, now that our air is out, I can inject it into my to-break-it-in purified protein and just the water in it so I can mix the powder and the water. Okay, and then I will engage the safety and I can put this into the needle disposer. So, and then I will mix this together until all of the powder is absorbed and it's completely liquid. So next I'm going to do my ceftriaxone after this. So first I'll put it in my TB needle and then label it and then I can move on. Perfect. So because I'm going to be switching needles, I need to re-wipe down the top of my lid. For about 10 to 15 seconds again. Perfect. And now I can get my TB needle and inject 0.1 milliliters into the syringe. So I will just uncap it and I will put 0.1 milliliters of air. Perfect. And put it into the vial. And then I will get 0.1 milliliters. And again, I'm just going to go a touch over so I can squeeze out any extra air. Okay. And then I'm going to do the one-handed scoop method. And I'm going to put my label on my drug. So this is my PPD test. I'm giving 0.1 milliliters and it is 1025 of 10/4/19. Okay. And then I can set that one on my tray. And I will dispose of my garbage before I start my next one, which is my ceftriaxone. Ceftriaxone, 250 milligrams. So I can uncap both of these and again use an alcohol swab to clean the tops of the lids. Again for about 10 to 15 seconds each. Okay, and as that dries, I'm just going to throw out my medication, or my garbage, sorry. And I can open up my syringe. And normally we'd be using a blue syringe, but because I am videoing today, I was advised just to use a black one as we aren't administering this medication anyways. So I will uncap it, and now that that is dry, I'm going to get 3 milliliters of air. So I have 3 milliliters of air, and then I'll inject it into my sterile water. Okay, and then I will just flip up and bring the needle below the water line so I don't bring in any air. So I do see I have a tiny air bubble in there, so I'm gonna again grab a little bit more than 3 milliliters of liquid, just so then I can squeeze out that air and still have the 3 milliliters. Perfect. Okay. And now I can inject it into my powder, which is my ceftriaxone, 250 milligrams, and insert the water. Okay. And then I will engage the safety on, sorry, not yet. I'm going to do the one-handed scoop method because I do need to use this needle to withdraw the ceftriaxone from the vial, and then I can change my needle tip. So I'm just going to mix this again, making sure all of the powder is absorbed and there's no clumps. You see there's a little bit of powder in the lid there. Okay, and now that it is all absorbed, I am going to take the same needle I was using and I'm going to draw 1 milliliter of air. Okay, 1 milliliter air, and inject it into my vial. Squeeze my air in, and then I will take 1 milliliter of ceftriaxone. I do see I have some air in there, so I'm going to take a little extra again. Perfect. And I'm actually not going to squeeze my air out yet. Sorry, as I need to change my needle tip, so I'm going to engage the safety, untwist this one, and throw it into my needle disposer and get this new needle end. Okay. And then I can squeeze the air out, which I put quite a bit extra than 1 milliliter because I do see I did suck back quite a bit of air. So now all my air is out and I have exactly 1 milliliter. So I'm just going to dispose of this. And now I can write my ceftriaxone. Oops. So ceftriaxone, we are giving 1 milliliter, and it is 10:30 now of 10/4/19. And then I'll throw my label on this one. Now this one we aren't actually giving today. I'm just showing you reconstituting and withdrawing. So I will still put that on my tray. And lastly, we have our ampule. So I'm going to grab a sterile wipe and wipe off the top of this, kind of in the neck of the ampule. And this is my promethazine hydrochloride, 250 milligrams, and I did already do my dimensional analysis for this, as this is a 50, as this one says 50 milligrams, so I know I need 0.5 milliliters of medication. So as that dries, I'm just going to throw this away, and I will need a gauze. Okay. So I'm going to wrap the gauze around the top and break it towards me so glass shards don't fly at me if it happens. So I'm just going to break it open and dispose of this in the sharps container as it is glass. So now I can take my syringe and open it. And then I will need a filtering needle to filter out any glass that could have fallen into the ampule. Okay. And for the ampule, we don't need to draw up any air. We can just take the liquid. So I'm going to insert this into the vial and get 0.5 milliliters. And I do see I have some air, so I'm going to suck back extra again so I can push that out. And I will need the air to change my needle tip anyway, so I can just leave it in there for now. So I will do the one-handed scoop technique. And place this back on, and then I can untwist my needle. And then I can take this one to administer with. Okay, and I will squeeze the air out now that I have my new needle. Perfect, and now I have 0.5. And I can label this one as well. I will dispose of my needle into the sharps container and dispose of the garbage. And then I will put my my label on my medication, and this is 0.5 milliliters. And it is now 10:32, 10/4/19. Okay. Okay, so now that I have all my medications prepared, I can clean up my workstation before going to the patient's room, deglove, and I would dispose of my vials per facility policy, and depending on the type of medication. So just going to set these here. Okay, and now we're going to make our way to my patient's room. Okay, so I'm going to do some hand hygiene and then re-glove. Hi, my name is Andrea. I'm your nurse. Say, how are you? Good, that's good. Okay, I know I was in here earlier, but I have your medications now, your 10:30 medications. So can you just confirm your name and date of birth for me? Shirley Cost, 54. Good. And your date of birth, sorry? 05/14/64. 05/14/64. Perfect, that's great. And I see you have an allergy to codeine, which it does say that on my MAR, and none of these medications say have that, so we don't have to worry. So I'm just going to raise the bed slightly. Okay, and I'm going to sit you up a little bit more, and then you tell me if you're comfortable. And are you comfortable there? Oh, good, perfect. Okay, and then I would lower the side rail. And so today for you I have a purified protein derivative, which is a TB skin test. And I also have a promethazine hydrochloride, which, are you still nauseated as you were when you complained earlier this morning? Yeah, okay, then I can administer that to you. It's for your nausea and it should help. And again, that was administered last night at 11, so I can administer that now at 10:40 a.m. So I'm going to start with your TB skin test, okay? So I'm just going to wipe down your skin, going from inner to outer for about 10 to 15 seconds. And then as that dries, I'm going to prepare my needle. Okay, so I'm going to put this TB underneath your skin. If you need to look away, totally understand. I am definitely like that when I get needles myself. So I'm just going to pull back the skin. Now I have practiced on this injected quite a bit, so I'm just looking for somewhere that I haven't already made a hole. Okay, right there. And I'm going to look for the end of my needle, or my needle just underneath the skin. Okay, on the count of 3, I'm going to inject it. 1, 2, 3. Perfect. Okay, and I'm going to take it out. That wasn't so bad, was it? No, okay, good. And then I'm just going to take, a gauze and wipe up any extra there. And we are looking for the wheel on this, which is right there. Okay. And then I will circle it and initial it. And date and time. So I would date and time it. So my pen doesn't seem to be working on the skin, and I find that whenever I use Sharpie, it does stain it. So I decided not to use Sharpie today, and my wheel has disappeared as it all came back out the hole, but as you see earlier that I did make the wheel. And I would circle, initial, and date and time it. So I will dispose of my needle before I continue. Okay, so we aren't going to give this ceftriaxone today, but so next I have your promethazine hydrochloride, and that's for your nausea again. So I'm just going to wipe down your arm quickly. Okay, and as that dries, I'm just going to initial that I have given your ceftriaxone, or sorry, your PPD, and it is now 10:45, and I will give your Phenergen. Okay, so I'm going to prepare my Band-Aid. Making sure that this is still covering the sticky part, as I don't want to contaminate it before it goes onto our skin. Okay, and I will just decap this. Okay, it's going to be a little pinch. Okay, I'm going to insert this on the count of 3. Are you ready? Yeah, okay. 1, 2, 3. Okay, perfect. And then I'm going to release this at about a rate of 5 seconds, since I only have about 0.5 milliliters. Okay, and then I leave it in there for about 10 to 15 seconds. Okay, and then I can take it out. And as I engage the safety, I will massage the injection site, and then I can place a Band-Aid. Okay. So I'm just going to put a Band-Aid on your skin, Shirley, just in case you bleed a little bit. Okay, so that is all the medications I have for you today, Shirley. Do you have any questions? No? Okay, and are you feeling okay? Okay, good. I will be back to check on you in a little bit just to see how your nausea has been and if that injection helped. So I would lower the bed and lower the patient to a comfortable position, deglove, do my hand hygiene and clean up my workstation, as well as dispose of my last needle, and which I will do right now. And then after hand hygiene and making sure my patient is in a comfortable position and documenting all the medications I give, that would be the end of this video.